الرحمن الرحیم. الهی قلبی محجوب و نفسی معیوب و هوایی غالب و طاعتی قلیل و معصیتی کثیر و لسانی مقر بالذنوب فكيف حيلتي يا ستار العيوب ويا علام الغيوب ويا كاشف الكروب اغفر ذنوبي كلها بحرمة محمد وآل محمد يا غفار 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 يا غفار. بسم الله الرحمن الرحيم. اللهم إني أسألك برحمتك التي وسعت كل شيء وبقوتك التي قهرت بها كل شيء وخضع له كل شيء وظل له كل شيء وبجبروتك التي غلبت بها كل شيء وبعزتك التي لا يقوم له شيء وبعظمتك التي ملأت كل شيء وبسلطانك الذي على كل شيء وبوجهك الباقي بعد فناء كل شيء وبأسمائك التي ملأت أركان كل شيء وبعلمك الذي أحاط بكل شيء وبنور وجهك الذي أضاء له كل شيء يا نور يا قدوس يا نور يا قدوس يا نور يا قدوس يا أول الأولين ويا آخر الآخرين اللهم اغفر لي الذنوب التي تهتك العصام اللهم اغفر لي الذنوب التي تنزل النقام اللهم اغفر لي الذنوب التي تغير النعم اللهم اغفر لي الذنوب التي تحبس الدعاء اللهم اغفر لي الذنوب التي تنزل البلاء اللهم اغفر لي كل ذنب أذنبته وكل خطيئة أخطأتها اللهم إني أتقرب إليك بذكرك وأستشفع بك إلى نفسك وأسألك بجودك أن تدنيني من قربك وأن توزعني شكرك وأن تلهمني ذكرك. اللهم إني أسألك سؤال خاضع متضلل خاشع أن تسامحني وترحمني وتجعلني بقسمك راضيا قانعا وفي جميع الأحوال متواضعا. اللهم وأسألك سؤال من اشتدت فاقته وأنزل بك عند الشدائد حاجته وعظم فيما عندك رغبته. اللهم عظم سلطانك وعلى مكانك وخفي مكرك وظهر أمرك وغلب قهرك وجرت قدرتك ولا يمكن الفرار من حكومتك. اللهم لا أجد لذنوبي غافرا ولا لقبائحي ساترا ولا لشيء من عملي القبيح بالحسن مبدلا غيرك. لا إله إلا أنت سبحانك وبحمدك. ظلمت نفسي ظلمت نفسي ظلمت نفسي وتجرأت بجهلي وسكنت إلى قديم ذكرك لي ومنك علي. اللهم مولاي كم من قبيح سترته وكم من فادح من البلاء أقلته وكم من عثار وقيته وكم من مكروه دفعته وكم من ثناء جميل لست أهلا له نشرته. اللهم عظم بلائي وأفرط بي سوء حالي وقصرت بي أعمالي وقعدت بي أغلالي وحبسني عن نفعي بعد أملي وخدعتني الدنيا بغرورها ونفسي بجنايتها ومطالي. يا سيدي فأسألك بعزتك ألا يحجب عنك دعائي سوء عملي وفعالي ولا تفضحني بخفي ما اطلعت عليه من سري ولا تعاجلني بالعقوبة على ما عملته في خلواتي من سوء فعلي وإساءتي ودوام تفريطي وجهالتي وكثرة شهواتي وغفلتي. وكن اللهم بعزتك لي في كل الأحوال رؤوفا وعلي في جميع الأمور عطوفا. إلهي وربي من لي غيرك أسأله كشف ضري والنظر في أمري. إلهي ومولاي، أجريت علي حكما اتبعت فيه هوى نفسي، ولم أحترس فيه من تزيين عدوي، فغرني بما أهوى وأسعده على ذلك القضاء، فتجاوزت بما جرى علي من ذلك بعد حدودك، وخالفت بعد أوامرك، فلك الحمد علي في جميع ذلك، ولا حجة لي فيما جرى علي فيه قضاؤك، وألزمني حكمك وبلاؤك. وقد أتيتك يا إلهي بعد تقصيري وإسرافي على نفسي، معتذرا نادما منكسرا مستخيلا مستغفرا منيبا مقرا مذعنا معترفا، لا أجد مفرا مما كان مني ولا مفزعا، أتوجه إليه في أمري غير قبولك عذري وإدخالك إياي في سعة رحمتك. اللهم فاقبل عذري وارحم شدة ضري، وفكني من شد وثاقي. يا رب ارحم ضعف بدني، يا رب ارحم ضعف بدني، يا رب ارحم ضعف بدني وشدة رقي ورقة جلدي ودقة عظمي، يا من بدأ خلقي وذكري وتربيتي وبري وتغذيتي، وهبني لابتداء كرمك وصالف برك بي يا إلهي وسيدي وربي. أتراك معذبي بنارك بعد توحيدك، وبعد من طوى عليه قلبي من معرفتك، ولهج به لساني من ذكرك، واعتقده ضميري من حبك، وبعد صدق اعترافي ودعائي خاضعا لربوبيتك. هيهات أنت أكرم من أن تضيع من ربيت، أو تبعد من أدنيت، أو تشرد من آويت، أو تسلم إلى البلاء من كفيته ورحمت. وليت شعري يا سيدي وإلهي ومولاي، أتسلط النار على وجوه خرت لعظمتك ساجدا، وعلى ألسن نطقت بتوحيدك صادقا، وبشكرك مادحا، وعلى قلوب اعترفت بإلهيتك محققا، وعلى ضمائر حوت من العلم بك حتى صارت خاشعة، وعلى جوارح سعت إلى أوطان تعبدك طائعة وأشارت باستغفارك مذعنة ما هكذا الظن بك ولا أخبرنا بفضلك عنك يا كريم يا رب يا كريم يا رب يا كريم يا رب وأنت تعلم ضعفي عن قليل من بلاء الدنيا وعقوباتها وما يجري فيها من المكاره على أهلها على أن ذلك بلاء ومكروه قليل مكثور يصير بقاء قصير مدته فكيف احتمالي لبلاء الآخرة وجليل وقوع المكاره فيها وهو بلاء تطول مدته ويدوم مقامه ولا يخفف عن أهله لأنه لا يكون إلا عن غضبك وانتقامك وسخطك وهذا ما لا تقوم له السماوات والأرض يا سيدي فكيف لي وأنا عبدك الضعيف الذليل الحقير المسكين المستكين يا إلهي وربي وسيدي ومولاي لأي الأمور إليك أشكو ولما منها أضج وأبكي لأليم العذاب وشدته أم لطول البلاء ومدته فلئن صيرتني للعقوبات مع أعدائك وجمعت بيني وبين أهل بلائك وفرغت بيني وبين أحبائك وأوليائك فهبني يا إلهي وسيدي ومولاي وربي صبرت على عذابك فكيف أصبر على فراقك وهبني صبرت على حر نارك فكيف أصبر عن النظر إلى كرامتك أم كيف أشكو في النار ورجائي عفوك فبعزتك يا سيدي ومولاي أقسم صادقا لئن تركتني ناطقا لأضجن إليك بين أهلها ضجيج الآملين ولا صرخن إليك صراخ المستصرخين ولا أبكين عليك بكاء الفاقدين ولا أنادينك أين كنت يا ولي المؤمنين يا غاية آمال العارفين يا غياث المستغيثين يا غياث المستغيثين يا غياث المستغيثين يا حبيب قلوب الصادقين ويا إله العالمين أفتراك سبحانك يا إلهي وبحمدك تسمع فيها صوت عبد مسلم سجن فيها بمخالفته وضاق طعم عذابها بمعصيته وحبس بين أطباقها بجرمه وجريرته وهو يذج إليك ذجيج مؤمل لرحمتك ويناديك بلسان أهل توحيدك ويتوسل إليك بربوبيتك يا مولاي فكيف يبقى في العذاب وهو يرجو ما سلف من حلمك أم كيف تؤلمه النار وهو يأمل فضلك ورحمتك أم كيف يحرقه لهيبه وأنت تسمع صوته وترى مكانه أم كيف يشتمل عليه زفيره وأنت تعلم ضعفه أم كيف يتغلغل بين أطباقها وأنت تعلم صدقه أم كيف تزجره زبانيتها وهو يناديك يا رب أم كيف يرجو فضلك في عتقه منه فتتركه فيها هيهات ما ذلك الظن بك ولا المعروف من فضلك ولا مشبه لما عاملت به الموحدين من برك وإحسانك فباليقين أقطع لولا ما حكمت به من تعذيب جاحديك وقضيت به من إخلاد معانديك لجعلت النار كلها بردا وسلاما وما كان لأحد فيها مقرا ولا مقاما لكنك تقدست أسماؤك أقسمت أن تملأها من الكافرين من الجنة والناس أجمعين وأن تخلد فيها المعاندين وأنت جل ثناؤك قلت مبتدئا وتطولت بالإنعام متكرما أفمن كان مؤمنا كمن كان فاسقا لا يستوون إلهي وسيدي فأسألك بالقدرة التي قدرته وبالقضية التي حتمتها وحكمتها وغلبت من عليه أجريتها أن تهب لي في هذه الليلة وفي هذه الساعة كل جرم أجرمته وكل ذنب أذنبته وكل قبيح أسررته وكل جهل عملته كتمته أو أعلنته أخفيته أو أظهرته وكل سيئة أمرت بإثباتها الكرام الكاتبين الذين وكلتهم بحفظ ما يكون مني وجعلتهم شهودا علي مع جوارحي وكنت أنت الرقيب علي من ورائهم والشاهد لما خفي عنهم وبرحمتك أخفيت وبفضلك سترت وأن توفر حظي من كل خير أنزلت أو إحسان فضلت أو بر نشرت أو رزق بسطت أو ذنب تغفر أو خطأ تستر يا ربي يا ربي يا رب يا ربي يا ربي يا رب يا ربي يا إلهي وسيدي ومولاي ومالك رقي يا من بيده ناصيتي يا عليما بضري ومسكنتي يا خبيرا بفقري وفاقتي يا ربي يا ربي يا رب يا ربي يا ربي يا ربي يا رب أسألك بحقك وقدسك وأعظم صفاتك وأسمائك أن تجعل أوقاتي من الليل والنهار بذكرك معمورا وبخدمتك موصولا وأعمالي عندك مقبولا حتى تكون أعمالي وأورادي كلها وردا واحدا وحالي في خدمتك سرمدا يا سيدي يا من عليه معولي يا من إليه شكوت أحوالي يا ربي يا ربي يا رب يا ربي يا ربي يا ربي قو على خدمتك جوارحي واشدد على العزيمة جوانحي وهب لي الجد في خشيتك والدوام في الاتصال بخدمتك حتى أصرح إليك في ميادين السابقين وأسرع إليك في البارزين وأشتاق إلى قربك في المشتاقين وأدنو منك دنو المخلصين وأخافك مخافة الموقنين وأجتمع في جوارك مع المؤمنين اللهم ومن أرادني بسوء فأرد ومن كادني فكد واجعلني من أحسن عبيدك نصيبا عندك وأقربهم منزلة منك وأخصهم زلفة لديك فإنه لا ينال ذلك إلا بفضلك وجد لي بجودك واعتف علي بمجدك واحفظني برحمتك واجعل لساني بذكرك لهجا وقلبي بحبك متيما ومن علي بحسن إجابتك وأقلني عثرتي واغفر زلتي فإنك قضيت على عبادك بعبادتك وأمرتهم بدعائك وضمنت لهم الإجابة فإليك يا رب نصبت وجهي وإليك يا رب مددت يدي فبعزتك استجب لي دعائي وبلغني مناي ولا تقطع من فضلك رجائي واكفني شر الجن والإنس من أعدائي يا سريع الرضا يا سريع الرضا يا سريع الرضا اغفر لمن لا يملك إلا الدعاء فإنك فعال لما تشاء يا من اسمه دواء وذكره شفاء يا من اسمه دواء وذكره شفاء وطاعته غنى ارحم من رأس ماله الرجاء وسلاحه البكاء يا سابق النعم يا دافع النقم يا نور المستوحشين في الظلام يا عالما لا يعلم صل على محمد وآل محمد وافعل بما أنت أهله وصلى الله على رسوله والأئمة الميامين من آله وسلم تسليما كثيرا كثيرا برحمتك يا أرحم الراحمين.
My elders, brothers and sisters in Islam, Assalamu alaikum. Can we have one salawat for Dr. Amir Shani and his recitation of Dua Kumail? Allahumma salli ala Muhammad wa ali Muhammad. Tonight's program is sponsored by Bande Khuda for the Asala Thawab of Marhumin in the donor's family and all Marhumin. Please recite the Surah Fatiha for all Marhumin. AV team, can you switch to Yasin slide? Tonight's Chalismo of Marhuma Roshan Banu Wisram from Vancouver. Marhuma was the wife of Marhum Hussain Ali Wisram and the mother of Sikandar Wisram, Nasim Mita and Naina Manji. Mother-in-law of Anis, Moaz and Farouk. She leaves behind 8 grandchildren and she was the aunt of Fatima Ladina, Mumtaz Natu and Feroz Jessa. May Allah bless the departed soul with and a place amongst them chosen ones. You're kindly requested to recite Surah Fatiha for the marhum. Yasin is being recited tonight for the following marhumin. Marhum Feroz Mehrali passed away in London. Marhuma Behrin Mehrali. Marhuma Roshan Banu Wisram. And next we'll have Surah Yasin by Kashif Ali Jafar. Can I have one salawat, please?
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ياسين والقرآن الحكيم إنك لمن المرسلين على صراط مستقيم تنزيل العزيز الرحيم لتنذر قوما ما أنذر آباؤهم فهم غافلون لقد حق القول على أكثرهم فهم لا يؤمنون إنا جعلنا في أعناقهم أغلالا فهي إلى الأذقان فهم مقمحون وجعلنا من بين أيديهم سدا ومن خلفهم سدا فأغشيناهم فهم لا يبصرون وسواء عليهم أأنذرتهم أم لم تنذرهم لا يؤمنون إنما تنذر من اتبع الذكر وخشي الرحمن بالغيب فبشره بمغفرة وأجر كريم إنا نحن نحيي الموتى ونكتب ما قدموا وآثارهم وكل شيء أحصيناه في إمام مبين وكل شيء أحصيناه في إمام مبين واضرب لهم مثلا أصحاب القرية إذ جاءها المرسلون إذ أرسلنا إليهم اثنين فكذبوهما فعززنا بثالث فقالوا إنا إليكم مرسلون قالوا ما أنتم إلا بشر مثلنا وما أنزل الرحمن من شيء إن أنتم إلا تكذبون قالوا ربنا يعلم إنا إليكم لمرسلون وما علينا إلا البلاغ المبين قالوا إنا تطيرنا بكم لئن لم تنتهوا لنرجمنكم وليمسنكم منا عذاب أليم قالوا طائركم معكم أئن ذكرتم بل أنتم قوم مسرفون وجاء من أقصى المدينة رجل يسعى قال يا قوم اتبعوا المرسلين اتبعوا من لا يسألكم أجرا وهم مهتدون وما لي لا أعبد الذي فطرني وإليه ترجعون أأتخذ من دونه آلهة إن يردني الرحمن بضر لا تغن عني شفاعتهم شيئا ولا ينقذون إني إذا لفي ضلال مبين إني آمنت بربكم فاسمعون قيل ادخل الجنة قال يا ليت قومي يعلمون بما غفر لي ربي وجعلني من المكرمين وما أنزلنا على قومه من بعده من جند من السماء وما كنا منزلين إن كانت إلا صيحة واحدة فإذا هم خامدون يا حسرة على العباد ما يأتيهم من رسول إلا كانوا به يستهزئون ألم يروا كم أهلكنا قبلهم من القرون أنهم إليهم لا يرجعون وإن كل لما جميع لدينا محضرون وآية لهم الأرض الميتة أحييناها وأخرجنا منها حبا فمنه يأكلون وجعلنا فيها جنات من نخيل وأعناب وفجرنا فيها من العيون ليأكلوا من ثمره وما عملته أيديهم أفلا يشكرون سبحان الذي خلق الأزواج كلها مما تنبت الأرض ومن أنفسهم ومما لا يعلمون وآية لهم الليل نسلخ منه النهار فإذا هم مظلمون والشمس تجري لمستقر لها ذلك تقدير العزيز العليم والقمر قدرناه منازل حتى عاد كالعرجون القديم لا الشمس ينبغي لها أن تدرك القمر ولا الليل سابق النهار وكل في فلك يسبحون وآية لهم أنا حملنا ذريتهم في الفلك المشحون وخلقنا لهم من مثله ما يركبون وإن نشأ نغرقهم فلا صريخ لهم ولا هم ينقذون إلا رحمة منا ومتاعا إلى حين وإذا قيل لهم اتقوا ما بين أيديكم وما خلفكم لعلكم ترحمون وما تأتيهم من آية من آيات ربهم إلا كانوا عنها معرضين وإذا قيل لهم أنفقوا مما رزقكم الله قال الذين كفروا للذين آمنوا أنطعم من لو يشاء الله أطعمه إن أنتم إلا في ضلال مبين ويقولون متى هذا الوعد إن كنتم صادقين ما ينظرون إلا صيحة واحدة تأخذهم وهم يخصمون فلا يستطيعون توصية ولا إلى أهلهم يرجعون ونفخ في الصور فإذا هم من الأجداث إلى ربهم ينسلون قالوا يا ويلنا من بعثنا من مرقدنا هذا ما وعد الرحمن وصدق المرسلون إن كانت إلا صيحة واحدة فإذا هم جميع لدينا محضرون فاليوم لا تظلم نفس شيئا ولا تجزون إلا ما كنتم تعملون إن أصحاب الجنة اليوم في شغل فاكهون هم وأزواجهم في ظلال على الأرائك متكئون لهم فيها فاكهة ولهم ما يدعون سلام قولا من رب رحيم وامتازوا اليوم أيها المجرمون ألم أعهد إليكم يا بني آدم ألا تعبدوا الشيطان إنه لكم عدو مبين وأن اعبدوني هذا صراط مستقيم ولقد أضل منكم جبلا كثيرا أفلم تكونوا تعقلون هذه جهنم التي كنتم توعدون هذه جهنم التي كنتم توعدون اصلوها اليوم بما كنتم تكفرون اليوم نختم على أفواههم وتكلمنا أيديهم وتشهد أرجلهم بما كانوا يكسبون ولو نشاء لطمسنا على أعينهم فاستبقوا الصراط فأنى يبصرون ولو نشاء لمسخناهم على مكانتهم فما استطاعوا مضيا ولا يرجعون ومن نعمره ننكسه في الخلق أفلا يعقلون وما علمناه الشعر وما ينبغي له إن هو إلا ذكر وقرآن مبين لينذر من كان حيا ويحق القول على الكافرين أولم يروا أنا خلقنا لهم مما عملت أيدينا أنعاما فهم لها مالكون وذللناها لهم فمنها ركوبهم ومنها يأكلون ولهم فيها منافع ومشارب أفلا يشكرون واتخذوا من دون الله آلهة لعلهم ينصرون لا يستطيعون نصرهم وهم لهم جند محضرون فلا يحزنك قولهم إنا نعلم ما يسرون وما يعلنون أولم ير الإنسان أنا خلقناه من نطفة فإذا هو خصيم مبين وضرب لنا مثلا ونسي خلقه قال من يحيي العظام وهي رميم قل يحييها الذي أنشأها أول مرة وهو بكل خلق عليم الذي جعل لكم من الشجر الأخضر نارا فإذا أنتم منه توقدون أوليس الذي خلق السماوات والأرض بقادر على أن يخلق مثلهم بلى وهو الخلاق العليم إنما أمره إذا أراد شيئا أن يقول له كن فيكون فسبحان الذي بيده ملكوت كل شيء وإليه ترجعون صدق الله العلي العظيم.
Thank you, Brother Kashif Ali, for that recitation. If we could all please stand for Ziyarat al-Warith recited by Brother Hassan Ali.
Bismillahir Rahmanir Rahim. Allahumma salli ala Muhammadin wa ali Muhammad. Assalamu alayka ya Rasulallah. Assalamu alayka ya Amir al-Mu'minin. Assalamu alayki ya Fatima Az-Zahraa. Assalamu alayka ya Hasan al-Mujtaba. Assalamu alayka ya Aba Abdillah. Assalamu alayka ya ibn Rasulillah. Assalamu alayka wa rahmatullahi wa barakatuh. Assalamu alayka ya waritha Adama Safwatillah. Assalamu alayka ya waritha Nuhin Nabiyillah. Assalamu alayka ya waritha Ibrahim Khalilillah. Assalamu alayka ya waritha Musa Kalimillah. Assalamu alayka ya waritha Isa Ruhillah. Assalamu alayka ya waritha Muhammadin Habibillah. Assalamu alayka ya waritha Ali Amir al-Mu'minin Ali Waliyullah. Assalamu alayka ya ibn Muhammadin al-Mustafa. Assalamu alayka ya ibn Ali al-Murtada. Assalamu alayka ya ibn Fatima Az-Zahraa. Assalamu alayka ya ibn Khadijah al-Kubra. Assalamu alayka ya Thar Allah wa ibn Thari wal-Bitr al-Mawtur. أشهد أنك قد أقمت الصلاة وآتيت الزكاة وأمرت بالمعروف ونهيت عن المنكر وأطعت الله ورسوله حتى أتاك اليقين. ولعن الله أمة قتلت ولعن الله أمة ظلمت ولعن الله أمة سمعت بذلك فرزيت به. يا مولاي يا أبا عبد الله أشهد أنك كنت نورا في الأسلاب الشامخة والأرحام المطهرة لم تنجسك الجاهلية بأنجاسها ولم تلبسك من متلهمات ثيابها. وأشهد أنك من دعائم الدين وأركان المؤمنين. وأشهد أنك الإمام البر التقي الرضي الزكي الهادي المهدي. وأشهد أن الأئمة من ولدك كلمة التقوى وعلام الهدى والعروة الوثقى والحجة على أهل الدنيا. وأشهد الله وملائكته وأنبياءه ورسله أني بكم مؤمن وبيا بكم موقن بشرائع ديني وخواتيم عملي وقلبي لقلبكم سلم وأمري لأمركم متبع. صلوات الله عليكم وعلى أرواحكم وعلى أجسادكم وعلى أجسامكم وعلى شاهدكم وعلى غائبكم وعلى ظاهركم وعلى باطنكم. حضرت علی أكبر. السلام عليك يا ابن رسول الله. السلام عليك يا ابن نبي الله. السلام عليك يا ابن أمير المؤمنين. السلام عليك يا ابن الحسين الشهيد. السلام عليك أيها الشهيد وابن الشهيد. السلام عليك أيها المظلوم وابن المظلوم. لعن الله أمة قتلت، ولعن الله أمة ظلمت، ولعن الله أمة سمعت بذلك فرضيت به. زيارة الشهداء كربلاء. السلام عليكم يا أولياء الله وأحباء. السلام عليكم يا أصفياء الله ووداء. السلام عليكم يا أنصار دين الله. السلام عليكم يا أنصار رسول الله. السلام عليكم يا أنصار أمير المؤمنين. السلام عليكم يا أنصار فاطمة الزهراء سيدة نساء العالمين. السلام عليكم يا أنصار أبي محمد الحسن بن علي الولي الزكي الناصري. السلام عليكم يا أنصار أبي عبد الله. بأبي أنتم وأمي تبتم وتابت الأرض التي فيها دفنتم وفزتم فوزا عظيما. ويا ليتني كنت معكم فأفوز معكم. سادة العباس. السلام عليك يا أبا الفضل العباس بن أمير المؤمنين. السلام عليك يا ابن سيد الوصيين. السلام عليك يا ابن أول القوم إسلاما وأقدمهم إيمانا وأكرمهم بدين الله وأحوتهم على الإسلام. أشهد لقد نصحت لله ولرسوله ولأخيك فنعم الأخ المواسي. ولعن الله أمة قتلت، ولعن الله أمة ظلمت، ولعن الله أمة استحلت منك المحارم وانتهكت حرمة الإسلام. ونعم الصابر المجاهد المحامي الناصر والدافع عن أخيه المجيب إلى طاعة ربه الراكب فيما زهد فيه غيره من الثواب الجزيل والثناء الجميل. والحقك الله بدرجة آبائك في جنات النعيم. السلام عليكم يا سادتي وموالي جميعا ورحمة الله وبركاته. السلام عليك يا غريب القرباء السلطان أبا الحسن علي بن موسى رضا. كن شفيعنا وشفيع والدينا في يوم الجزاء ورحمة الله وبركاته. السلام عليك يا صاحب السوى الزمان. السلام عليك يا خليفة الرحمن. السلام عليك يا شريك القرآن. السلام عليك يا قابة الإيمان. السلام عليك يا إمامنا وإمام الإنس والجان. أجل الله فرجك وسهل الله تعالى مخرجك وظهورك ورحمة الله وبركاته.
देखते सर हाँ वो दे दो आप محمد وآل محمد صلوات بر محمد وآل محمد صلوات. I'd like to start the session, inshallah. We have about 40 minutes or so, and we'll hopefully conclude in that. If the ladies want to come on the gents side, there is a partition here, so you are welcome to come and participate in this particular seminar that we are having. I just wanted to mention a couple of things. This topic that we have chosen of self-care is really quite a vast topic. And there is no way that we are going to be able to do any justice to it in literally, 40 minutes. But we're going to at least have a conversation so that you can start to at least ponder and think about it. And then if there is interest, we can get into some very deep levels of self-care, which is very important. I'm really always thrilled to have Maulana Dr. Nasir Zaidi with me. If you look at Maulana Saab's CV, it's hard for me to even mention the accomplishments that he's had, the tremendous amount of Hausa training that he has had. Suffice it to say, I will say this with absolute confidence that, when you look at the ulama that we are blessed with, in Vancouver, I can tell you that the most senior figure as far as ulama is concerned with respect to knowledge and training and his connection with the Hausa and so on and so forth is Maulana Nasir Zaidi. We are really fortunate that, he continues to provide, services to the Az-Zahraa Islamic Center and the community at large. I've worked with him for many, many years. He has been a mentor to me as well. So I'm thrilled, Maulana Sahib, to have you with me. And I'll be very careful. I'm very nervous usually when I'm sitting next to him because he will correct me very quickly and I will feel very embarrassed when he does that. But so when we are talking about self-care, I wanted to just make some comments and I wanted to just contextualize it for us. And then we'll have a conversation with Maulana Sahib. And if the audience has any questions or they have a comment, if we can just have you put your hand up, whether it's from the ladies or the gents. And I think, Shaheen, we can maybe pass the mic around if that's the case. And we'll see if you have any comments. But I want to start to really at the basic level and to define health. So whenever you define health, you will see that health, a lot of people will define health as the absence of disease or infirmity, right? That's a lot of ways people, if you ask them, what do you mean by, your health, like what is health? They'll say, well, health is an absence of disease. But if you really look at the definition of health, it is absolutely not that definition. And even the WHO, the World Health Organization definition of health is very different from just the absence of disease, right? Health is commonly defined as a state of complete kind of physical, mental, emotional, social well-being. And it's rooted really in this whole holistic approach, which is what health is about, right? Your physical well-being, your body's functioning, fitness, nutrition, sleep, and so on, your mental well-being, whether your emotional state, your resilience emotionally, your cognitive functioning, stress management, psychological balance, and so on and so forth. And there is a very important component in the definition of health around your social well-being, and that includes supportive relationships, community belonging to a community, and the ability to meaningfully participate in society. But what is important when people define health is they forget to define the fact that there is the spiritual component of well-being as well. And what is that spiritual well-being that encompasses the definition of health? And that is having a sense of meaning and a sense of purpose, and perhaps we can call it inner peace, if you want to call it that, right? And it's especially relevant, of course, in a faith-based perspective, but not necessarily when you're talking about spirituality. Does it, as far as the definition is concerned, it may not go through a faith-based perspective at all.
So, Dr. Saab, just before move to this point, so can you hear me?
Yeah.
Okay. Yeah, I just wanted to add one thing that, so now we have a teamwork in the hospitals, and then when we have team meeting, so it is very important that all the dimensions and then aspects are being discussed there in the team. So doctors are there, psychiatrists are there, psychologists are there, or physiotherapists are there, occupational therapists are there, and social worker and spiritual health care professional is also there. All the reports are coming from all sides, and they are looking into the patient, and this is because of the definition of health has changed. It's not the absence of the illness, but it is complete well-being. So it means that it is very important. Maybe if you go to see my lab results, so there is no issue, but I am not functioning in the society. I am not participating in the life. So it means there are a lot of issues at lower level, not at the level of disorder or something. So this is why we have to pay attention to this. Please carry.
Thank you. So with that in mind, let's come to the topic today, which is self-care, right? And this idea of self-care right now is everywhere. And there is a real movement around self-care, and we have self-care coaches, and we have all kinds of different people, who will help you in your self-care. And sometimes self-care is really very narrowly framed, right? It's framed as, a reduction in, it's sort of reduced, self-care is reduced to like comfort, your comfort, productivity, momentary relief, from stress, and all kinds of temporary support systems that do not really answer the deeper questions about self-care, right? And certainly when you talk about self-care out there in society, there is very little of the narratives on self-care that are actually anchored in spirituality in any way, right? So this is something that we want to explore today. Now, just before I ask my questions to Maulana Sahib, and I gave you an opportunity to ask, from a psychological perspective, right, self-care may be related to developing one's own emotional well-being, right? Awareness of one's own emotional state or cognitive pattern, or one's limits or one's needs, and so on and so forth. But responding to those intentionally and not reactively. That's what self-care is about, right? It's when you are responding to something because of your awareness, you're responding to it intentionally and not reactively. That's what we tend to do normally. If you don't focus on self-care, then whenever you face an issue and a problem, you are actually responding reactively to it and not your response to it is reactive and it's not intentional, which is where the difference comes. Now, from an Islamic perspective, especially ingrained in Shia Islam, self-care cannot be separated from the care of the nafs, right? The care of your soul, right? The body, the mind, and the soul are all trusts of Allah subhanahu wa ta'ala from an Islamic perspective. And so, when you're looking at self-care, it's, sometimes, people look at it in a way where the conversation, shifts and it becomes a conversation where people start to say, well, isn't Islam all about caring for others and not for yourself, right? So how are you able to reconcile this whole idea of spirituality where, caring for others is, something that is highly, highly recommended in Islam, much more than caring for yourself? The conversation invites us to move beyond this sort of false binary, right, that we have of self-care versus self-sacrifice, right? What we really want to do is to explore self-care as a moral, as a spiritual, and a psychological responsibility, right, that enables us to engage in deeper worship, healthier relationships, and a sustained service to others, right? So this is really what we want to focus on today. So I'm going to ask first, Maulana Sahib, if you can give us, from a spiritual perspective, from a psychological perspective. Maulana is a spiritual healthcare consultant, a spiritual healthcare practitioner, but he's also done a lot of courses and his degrees in counseling, psychology, and other things. So from a Shia Islamic tradition, can you expand on this whole area of self-care in relationship to the nafs or to the ruh, or I think as, Urafa talk about relationship to the heart, right, to the qalb. So if you can expand on that.
Yeah, thank you so much for this explanation that you gave. So first of all, I want to say that when we talk about self-care, so we have to separately see first self or our soul or our heart from Islamic or mystic perspective. And then we also see what does it mean when we say care. We are caring about other people, caring for example, someone else. So it is very important to pay attention to the word care and self as well. So care means that when I'm caring you, it means that I am fully present for you. I am deeply listening you. I am non-judgmental. My presence is non-judgmental, and my presence is also very compassionate, and I am not making any judgment, and then deep listening is there. So similarly, I am doing to myself as well. From Islamic point of view, the point I want to make in the beginning, that this is, as Dr. Saab mentioned, that momentary. This is not just like it's a very small issue of self-care that normally we have this understanding. When it comes to the Islam and the teachings of Ahl Bayt alayhimus salam, so it means self-growth, moral and ethical and spiritual and intellectual, from every side, your growth and your development and your refinement is very important. So we are paying attention to this aspect when we are talking about self-care. So it is very practical and experiential aspect. So it means that how we are relating to ourselves, how we are relating to others, and how we are relating to the higher being, maybe God. So these aspects are important when we are talking about spiritual self-care from spiritual side or from religious point of view. So first thing that we understand is that we need to know, and we need to, as Dr. Mithani mentioned, that it should be intentional. It should not be reactional. It means I need to know what I am exactly doing. It means that I want to know myself. It means that I want to sit with myself. It means that I want to explore myself from intellectual side, from feelings and emotional side, and from practical side. So you know that in this era, it is very difficult now that we are too much engaged and attached to the worldly things, social media and other things. So we get very less time to sit with ourselves. So self-care means, first of all, the Quran is always, and then teachings of Ahl Bayt, and then Islam as a whole is emphasizing a lot on this issue, that we have to first of all refine ourselves, then we will be able to help the society, support other people, we can establish better relationship with other people. So this is important to know, that what is the meaning of self then. If, for example, when we talk about self, so it means we already know from Quranic perspective that human being is not created as a blank slate. We are created as an inbuilt orientation. Quran says, فَأَلْهَمَهَا فُجُورَهَا وَتَقْوَاهَا. So when we born, so we have already these inborn inclinations, tendencies. For example, we are seeker of truth by nature. We already have inclination towards God. We already have tendencies towards goodness. We already have tendencies, desire or understanding or love of beauty and love of perfection. Perfection is important for me, kamal and perfection. So, and purification, all these things are already in myself. But when I live in this world, and then worldly affairs, I am involved in and engaged in worldly matters, then my actual self is not there, and then it is absent. Then other, for example, things are there, and myself is hidden then. So I have to explore, I have to dig myself, and we have to reach to the basic and the essence of our soul and essence of our heart. So this aspect is important. And then Quran is also saying there are several stages of your nafs and your soul, and you have to be very careful that what level you have achieved, and you need to have true understanding about yourself. You don't need to have false understanding about yourself. You need to know that spiritually where you are existing right now. If we have false understanding, untrue understanding about ourselves, for example, I am saying, oh, I'm mu'min, I'm great mu'min, I'm doing great job and everything. So it means that sometimes we are not at this level. So this is also very important when we're talking about self-care. Yeah, you want to say that?
Yeah. So this is very important. So, Mullah Sahib, it's that old cliche, right? I mean, so many people give this example, right? Which is the example you see when you're in an aeroplane and they tell you that if the oxygen mask comes, then put the mask on for first yourself, and then you help others. Because if you don't put it for yourself, then you will not be able to help others, right? So I think that that's where you're coming from. And that's something that Islam is emphasizing, that you have to first grow and develop yourself before you are able to inspire and motivate others to do that growth. Yeah?
Yeah.
Yeah. Maulana Sahib, there is a question sometimes when it comes to the whole area of psychological well-being and self-care with respect to your own emotional state. So anxiety, in many cases burnout, that we face, emotional exhaustion. Sometimes I find in our communities that these things are spiritualized, right? So when you are facing these challenges of anxiety and burnout and emotional distress, we are sometimes spiritualizing this in a way that we say that psychological or emotional distress is seen, can it be seen as part of a human condition, or rather a weakness in faith, right? So sometimes people are saying, well, you are experiencing distress and emotional distress and anxiety and depression and all of this. It means that your faith is weak, and you have not, elevated your faith, because if your faith was not weak, you would never have these feelings. What is your opinion on this?
So I would say that this is very dangerous statement, and I have heard a lot of time from even our scholars. They're just easily saying that you have this mental issue or mental health problem, you have anxiety or you have depression because you have weak faith. So for example, you are not praying, or you are not, for example, there is no mercy of God for you, Allah is not showering His mercy upon you. So these kind of things that I am always listening from different scholars. But I would say from spiritual care perspective or from psychological perspective, that this is really very dangerous statement that when we are saying this one. Because if someone is going through some psychological issues, then it is not necessarily weakness of your iman. And we don't talk, this language is wrong, the wording is wrong, we don't talk like this one. We see, for example, if someone has anxiety, so we just easily we know that if someone is experiencing anxiety, so it means there are some underlying issues, and we explore, we see, for example, there is a unknown fear, and for example, there is a wrong understanding of so many things, or for example, we have unrealistic expectations. So similarly, we have psychological identification. This is a little bit deeper, but these 4 or 5 are basic factors when there is an anxiety. So when we psychologically and spiritually, when we see any patient and we are making our assessment, then we go and see from religious side. So we see, so if there is any strength from religious principles, for example, I'm religious person, and then we see that what religious and spiritual factors are there which can address this anxiety. For example, someone has fear of death, so fear of death is there, and then again someone is Muslim and mu'min, and fear of death is also there. So if someone is religious person, then we are looking into the sources of strength, and we are, for example, psychologically, we can talk about their approach towards death. We can help this person to reduce this fear, and then similarly, so it's not the weakness of religious weakness, we can say, but we can just talk on the issues, not on these kind of giving statements and judgmental statement that we are giving. So we say, for example, you are already connected to God. You already say that I believe in God. And then when you believe in God, then how come that you have fear? When you have a belief in the life after death, so why you are fearful? So then we are helping this person from religious side. We are acknowledging, we are validating, we are listening to this person, and we are helping, and this is patient-centered approach, and this is what we normally paying attention to this one. Yeah.
At any time, if you have a comment or a question, just raise your hand and we'll be happy to take any comments or questions. So if there aren't any, I'm just going to keep going because I have tons of questions that I have. But I want to also be able to hear from the people who are here. The whole point of this was that it should be more interactive, right? So I don't have a problem having a conversation, but it should be better if it's interactive. So let me ask you something else, Maulana Sahib. One of the major issues we face, there are many in this community, and I know people that I see them here, they are sitting. Some of the cases I know myself of people in our own community. There are many in our community who are caregivers, right? And they give care to their loved ones, to their parents, and so on and so forth. And when they feel like they have to look after themselves or they have to provide care to themselves, there is a huge guilt that comes over them because they feel that they are prioritizing their own well-being instead of, you know, the well-being of their parents or their spouse or something like that. How does Islam address this tension? You know, because this feeling of guilt is so huge that I feel that a lot of the members of the community, they burn themselves out. They become so involved in caring for their loved ones that they are not paying any attention to themselves, and they try and defend this from an Islamic perspective because they've been told that you should just focus on caring for your parents or your spouse. You should not be focusing on yourself. So how do you address this tension?
So, yeah, thank you so much. First of all, this is a really, really very important question. And then so we have a lot of cases, and we are always witnessing in our community that really caregivers and then our parents, whosoever, so they are, for example, providing their care. So they are going through this one. Dr. Saab, you mentioned about feeling of guilt or guilty feeling. First of all, I want to say that most of the time, when someone feels guilty, it is because of the wrong understanding and wrong assumptions. But in rare cases, I see that there is a real guilty somewhere is expressing this one. So guilty is related to our feelings, our emotions. And we need to know that our feelings or emotions are always following our thoughts. So thoughts, if there is something like wrong in our thoughts, if our understanding is wrong, if our perspective is wrong, so our feelings will follow our thoughts. So it means the main question is about self-care. So it is very clear from the Quranic verses and then ahadith, without going into the detail, that what example of aeroplane you gave already, this is the exact example. We have to pay attention to our self-care first. We have to pay attention to our psychological and spiritual well-being first. We cannot just say that because of my children, because of my parents, because of those who are being cared, and then I am providing care to these people, so I am ready to go into the depression. I am ready to go into the anxiety. Islam is not saying this at all. So how you will help the society, how you will So you will be more dangerous then if you are not paying attention to your psychological well-being. So it is extremely important that we are really paying attention to our well-being first, and then so how to understand this one? For example, we have lot of challenges, problems, in the family. For example, let's say the example of our children, and they are giving us very tough time, very tough time. And then how much we have to take the burden of our children. It is helping us when Quran is saying, La yukallifullahu nafsan illa wus'aha. This is the best Quranic verse which is helping us. That, for example, I am saying, oh, I am feeling guilty. Why I am feeling guilty? Because I am not, maybe I am not doing well to providing care to my children, for example, and God will punish me, or this may be sinful act from my side. But this Quranic verse is saying that God is not obligating you beyond your capacity. You have to see how much capacity, and this verse is really, if we pay attention to the deeper level of this verse, it is really providing us a lot of relief, and it is helping us to understand that how much it is important that we pay attention to our psychological and spiritual well-being, and then we should also provide care to other.
I really don't want this to be just a conversation. Are there any comments that anybody has? I want to give you a moment to express something, if you can. Go ahead, Saida. Can you just hold? There is a mic. There is a mic there.
Hello? Okay, it's just a short question. So would tafakkur be part of self-care?
So the question is that with tafakkur.
Yeah, you know when they say you have to do tafakkur, would that fall under self-care, or would that be something totally different?
Yes, when we are talking about self-care is related to caring our thoughts, our mental abilities, and this is psychological issue as well. So if we are weak from like mental side, intellectual and reasoning power, or so many mistakes that we are already doing logically, so it means that we are destroying ourselves. This will be very destructive. So it is very important that when we are talking about self-care, so it is also related to our tafakkur and our thoughts. Thank you so much for this, asking this one.
Anybody else who wants to ask any question? Any comments that you may have? Yes, please. That's a loaded question. So burnout is one of those kind of catchy words that we use in describing a emotional state where your resilience to be able to respond to your environment is basically has reached its limit, and now it is not within your own capacity. And so a lot of the times we use the word burnout to actually describe what is the consequence of burnout, because those are the symptoms that you see of burnout. So the symptoms that you see is sometimes mistaken for the actual condition of burnout, right? Burnout itself, leads to many different consequences, which can lead to anxiety, stress. It can trigger a lot of mental illnesses and so on and so forth. But burnout itself is when a human being goes beyond their capacity. and they're not, it's beyond their resilience that they have. And it's very important to understand that from a psychological perspective, because from a psychological perspective, if you are experiencing burnout, you will never be able to take the time to look after yourself, because you've now lost all your mental, psychological capacity in order to be able to respond to the environment that you have created for yourself, right? So the psychological coaches that you can pay, $250 an hour to have a psychological coach, use burnout as a very important part of what they provide services for in order to prevent you from going into burnout. But a lot of them, I just don't think that they actually understand the root cause. They go to the symptoms. They go to the manifestation of what burnout is, right? So that's what I think. Yeah, go ahead, Shane.
So the Quran ayat that we talked about, that Allah subhanahu wa ta'ala won't give you a burden you with something that you can't handle. But then why do we have like mental disease? Why do we have physical disease? Why do we have to have an intervention, for example, medication? Is there a where we're treating the illness too early, when the body or the mind could have coped with it on its own and could have resolved things on its own? Or are we over medicating in some cases?
Yeah, so you want to say something? So first of all, I would say you may be thinking that very easy to answer this question. This is one of the most difficult questions one may ask about this one. That, for example, we have hadith and maybe in Quran also, that Allah is not put, for example, pain and suffering more than your capacity. But all the times we are also seeing that it's beyond our, we can't even tolerate, we can't bear it, it's difficult for us, and it's too much pain, too much suffering in our life. And then how we can interpret this hadith or this understanding already principle? Is it your question?
It is, but I think you're probably getting to it. But
Probably.
so, like, do people have different resilience level, or is it like a muscle that we need to exercise? Maybe that anxiety is going to make us better. It's going to make us stronger. We should build on that anxiety. We should get over our challenges rather than just medicating them.
So two, three aspects are there already that you have mentioned. So separately maybe. Yes, of course, that this is very obvious that people have different level of already, for example, resilience that you mentioned. So when, for example, when we go to see patients, so it is one of the most important aspects when we are making our assessment, that how much resilience power is there in this resident or in this patient. So, and then if not, for example, how we can increase this, what this patient or resident has to do to increase, to strengthen them, to connect them. What is one of the very important aspects that we have in spiritual care, that people have strength, but they don't understanding, they are not aware of their strength. They are not aware of their spiritual powers. They cannot utilize this power. So what we try to do, to first of all explore these powers, these sources of strength, and then we connect these patients to their power. Once they are connected to this one, they feel like relief and other things. You can know.
Yeah, so I think you kind of partially answered your own question, but I think there is something that goes beyond that. So I think that, when you look at it from the perspective that you mentioned, is that I think every person has a potential. And many times we ourselves, because we have not focused on our own self-care, we have numbed our own potential, right? And we have not been able to realize our own potential. Every human being from an Islamic perspective is on a journey towards perfection, right? That is what the journey is. The journey is towards perfection, right? The journey is towards Allah, right? And I think what happens is that when you have not provided that self kind of care for yourself, you have not realized your potential. So I think sometimes these challenges that you face are exactly what you said, are a means for you to be able to realize your potential. Now, I don't see it the way you do, Shaheen. That, does that mean that, if I was to do that, that I would not suffer from any illnesses, be it physical, mental, or so on and so forth? I think that that's part of the process, right? So I think that's part of the process.
So maybe I misunderstood what you were saying earlier. That I took from what you were saying is that for self-care, you need to, I'm putting words in your mouth, but you need to avoid burdening yourselves with other people's problems, because you need to worry about yourself. So it's almost like you have to avoid putting more burden on yourself in order to care for yourself. But maybe what you're trying to say is that you have to build more resilience in yourself first so that you can take on more.
Exactly.
Yeah.
Exactly. That's exactly what I'm saying. Yes.
And I
don't sorry, Maulana, don't forget that, and this is why I defined, the spiritual aspect of self-care as being, one where you explore a self-care as a moral, spiritual, and psychological responsibility. So don't get out of this that it means that you don't care about anything else other than yourself. That's not self-care. That's individualism, right? That's very different, right? What you're doing is exactly what you're doing, is what you said, is you're building yourself with that resilience so that you can be more effective and better in providing that support that you may need to provide in society, in your family, and so on and so forth. But you can't do that unless you focus on yourself.
So I missed maybe you haven't talked about it, or maybe I didn't understand that part, is that how do we build that resilience? Is that another session?
That is exactly what we want to get to. We won't get to it today.
And it depends
but there
on
I'll let Maulana talk about it, but remember that resilience is built at different levels. It's built at a physical level, at a psychological, emotional level, and at a spiritual level. And that's why I started off with the definition of health, because it's not just one thing. It is when you look at the holistically, how do you do this so that you become a complete human being, right? Sorry.
Yeah, so you mentioned, what I just wanted to add is that it is all about when you are making assessment to someone, then you come to know that how much there is a potential in this patient or resident to be resilient or increase resilience in the patient. So assessment is always very important. And one thing, I think one part you were mentioning, but you didn't continue this one, that even our mental health issues, it is up to us, even it is not maybe mental health, more psychological or some other that emotional problems we are facing, we can make them for our growth, for our development, We can use, as you mentioned, one word, anxiety. So for example, if I go into the detail, for example, this anxiety can help you a lot, can make you grow and further spiritual and mental development. And similarly, stress is very good thing. If there is no stress, we will not be able to do anything. So this already we all know. So similarly, I just want to give example of the founder of spiritual care. He was Boyson, Anton Boyson, in 1920-25, like this. And he was a psychiatrist, he was a religious scholar, Christian, and he established this spiritual care system. And then interestingly, because nowadays I am working hard on his theories and what was the basically foundation of whatever he has said, and he established the clinical theology also and brought clergy and these scholars into the hospital and connected them through. So he was the mental health patient. He was admitted several times in mental health the hospital, and then he says that I learned a lot from my own mental sicknesses. And then he said that how I use this one, and then so lot of examples are there. For example, I will share my own experience. For example, I am already I have been seeing in Vancouver General Hospital's mental health many patients on daily basis. So for example, what they learn from there, those who are young, those who are able to reflect. So these mental health patients, they learn from their own sickness, and I'm always encouraging them to little bit think about that what you are going through. You have a very beautiful experience. Even no doctor, no psychiatrist, no psychologist, they have just studied this one, but you are experiencing these illnesses. So you have lot of power for them. And for example, they learn their how to separate thoughts, feelings and facts from each other. This is the biggest problem in mental health patients. They don't know about whether this is feelings, emotions, thoughts or facts. They are always mixing up. Once they learn this one, they are able to grow. Yeah.
Thank you for that. I feel that in today's society, and maybe even kind of what I started to get out of your talk in the beginning, is that these mental challenges are something we should avoid. Whereas when we talk about, let's say, bodybuilding, or they say no pain, no gain, unless you put your body through that stress, it's not going to build the muscle. So I think even the way that I feel in society is that all of this, like, it's a pendulum, right? That maybe the pendulum swung too far one way, but now it's gone too far the other way. That is, we have to avoid all kinds of mental stress, mental anguish, but I think the cost is that we're not building that resilience. We're not emphasizing that these are good things. Stress is good. There's a limit. I agree. Bullying.
Yeah.
There's a limit, but also how otherwise how are you going to experience the other side if you don't feel it yourself?
I don't think you can get away from it. I mean, I actually don't think you can get away from it, right? I mean, the pain, suffering, guilt, I think is always going to be surrounding you. And it will always be a matter of how you're going to be able to, navigate yourself through that. And the tools of navigation are really what we want to really focus on, like you said, next time if we want to have this another discussion. What are those tools of navigation? How do I navigate this within myself so that I'm able to manage it, right? لَقَدْ خَلَقْنَا الْإِنسَانَ فِي قَبْرٍ, right? The Quran, Allah says, I've actually created you in adversity, right? Maulana, is that right? I've created you in adversity. right? So don't try and think that you are going to lead a life without challenges, because then you'll have no growth, right? So your challenges are all going to be there, but I've also given you the potential, and the potential to be perfect, and the potential to rise, elevate yourself towards perfection is there. So how do I get there is really what the discussion we want to have about self-care, like practically what are the tools, right? So we have a couple of minutes left. We're about 5-10 minutes over
quick,
time.
In addition to Dr. Saab, we have two basically levels. At first level, we try to, in our families, in community environment, in our society, we are trying our best to prevent pain and suffering and any kind of mental illness. It is very important. But unfortunately, because of lack of seriousness in education, moral, ethical, and spiritual, and we are mostly more paying attention to entertainment aspects in our majales, in our, so if a speaker is providing entertainment, we feel more happy. But actual education and contents, so first really if we don't know how to create this spiritual and moral and ethical and intellectual environment, so first we try our best to prevent this one. But once we start experiencing pain and suffering, then we talk about this issue, that how you can use this pain of suffering for your own benefit, for your own growth, for to change your perspective. Like Hazrat Zainab Salamullah Alaiha, when she says that Ma ra'ito illa jamila, so when she's saying I didn't see anything except beauty. So beauty of, so now she has just transformed her pain and suffering to the beauty which is divine beauty, we would say. So then at this level, but we are not saying that Hazrat Zainab Salamullah Alaiha should face this suffering and other things. But once she went through this one, then she is how she's tackling and handling this issue. This was very important. Please.
So final comment, and then I want to conclude because we're way over.
Just want to make a comment on his question. I'm enjoying the conversation, but since medication, when an issue comes, either physiological issue, mental
So
issue.
Dr. Shani, can you first introduce yourself so then they can better understand what you are saying?
As a practitioner,
Yeah.
specialist, and the author of the book Chronic Illnesses, Combining Epigenetics and Medicine, which has been basic mine for the last 4 or 5 years.
You should also should be
is
here
chronic
with us.
illnesses.
Yeah. Yeah.
I'll deal with the chronic illnesses, either physiological or mental issues, or other issues which are chronic, and then obviously most of them are epidemic, basically these days, like diabetes and liver disease, cancers, and so on and so forth. Anyway, since you mentioned about the medication, then I'm a little bit sensitive about this word, because what we see on the conventional medicine is basically suppressing the symptoms using medication. We're talking about developing and resilience have been basically discussed, and as a part of our personal development, obviously basically the alternative way is just something else. So the chronic issues, rather than suppressing the symptom with some kind of medication, there might be another way, which obviously can be a better way and better option, to let our inner healing process to deal with it, and we don't have to go through the medication that soon, unless needed. In obviously acute situation, that's completely a different story. We're talking about chronic issues, and that helps our inner healing process to basically practice itself, to be activated, and can heal. This is basically the area of many research in the last few years, and not only can heal that chronic condition, but it also can help our inner healing process to develop, and obviously, develop our resilience, our practice to deal with it ourselves, either physiologically or mentally.
Yeah, I have to make a comment on that. So I am definitely a person who is very much committed to conventional medicine. So I'm not sure I see completely eye to eye with what you're saying. And I may not agree with everything that you're saying. But that's my training, and your training is different. I see that there is a continuum. I think there is a continuum in this. I'm not in any way saying what you are saying is necessarily wrong, but I do feel that there is a continuum. And I think what is important is to understand what the continuum is and how we deal with that continuum, whether it is at the level of epigenetics, whether it's the level of, at the molecular level, or whatever it is. So I think it's a separate conversation, but I think it's a process.
Yes, it is. Just one word based on what you're saying. Yes, I understand your training with conventional medicine. But I am trying to distinguish between acute condition and chronic.
I get it.
You're
I
not
understand.
talking about the acute
No, I
condition,
understand what
that's
you're
why.
saying. I
You're
understand
only
you're talking
the
about chronic
condition.
illnesses. I also have issues with that personally, even with respect to chronic illnesses. I think that there is a process where I think there can be harmony in both approaches. I don't think it's an either or approach. So that's
Yeah, again, conventional medicine approach, I'm not saying it's wrong at all.
Yeah.
That can be definitely a solution.
Right.
But what matters is this the only solution that we need to consider, or we have to look at the other way, especially in the longer term?
Fair enough.
I would be happy
Fair
to
enough.
sit down and have a
fair
different
enough.
conversation.
Fair enough. I want to conclude, Mulana, we are way over our time. So I want to give you an opportunity in the end just to conclude, so we can conclude the session for today.
I just one thing that I just want to mention. I'm not talking about like medical side, medication and then medicines and other things, but non-medical intervention. So you already know that already psychiatrists are there, counselors are there, spiritual care practitioners are there. They are also working hard with the same patient. So if, for example, if you are also there, so you are also deal and treat this patient from your perspective. So they are allowing you to do this one. So this is what I am seeing, and there is interconnectedness. They are very interconnected to each other. If they are, and now if our psychiatrists have understood properly this one, that if they are ignoring one of these issues, aspects, spiritual or social or whatever, so they cannot treat. Medication in itself cannot treat this patient. This is, I'm thinking that this is very important to understand. Okay, so I first of all, just in the end, I just want to conclude. It is important for us for self-care. First of all, we have deep understanding about our soul, about our heart, and it is good for us to, even in normal life, to be able to distinguish our thoughts and our feelings and our facts from each other. And the skill is required. It's not that easy. We are always mixing up these things, and when we don't know that our feelings are following our thoughts, then lot of mistakes we are already doing and committing this one. And then I also want to say that meaningfulness and purposefulness, how much we are meaningful. Unfortunately, we were not able to explore this terminology. This is extremely important, that how much my soul and my spirit and my heart is meaningful and purposeful. how much power and strength I have, the more meaningfulness I have. For example, the one who is believing in God, the one who is not believing in God, this person has less meaningfulness than the person who believes in God. Similarly, believing in life after death. So this is very obvious and very important for us. And then I also, the last thing I want to mention here, that we need to pay attention to three aspects, especially when we are discussing about self-care. First of all, what I am, what exactly I have to know that my soul and my spirit is. And then second is what I am having or what is in my possession. For example, I have car, I have bank balance, I have house, whatever I have, these are my belongings, these are my for example, whatever things and in my possession. And third thing is how I am being regarded in the society, how people are viewing me, how people are seeing me. Which one is most important? The most important is what actually I am. So this is important, that pay attention to my soul and my heart first, and then, for example, I should feel pride or something.
Thank you, Maulana Sahib. I think we will conclude that with those words of wisdom, inshallah. Thank you so much for coming. And if you enjoyed the session, you can let the program executive committee know, and if we need some follow-up, and we can get into some very specific tools and methodologies to help us in self-care, we can have a follow-up session of that. We'll end, if I can request, this is Thursday night, and Thursday night is a night of for our marhumin. So if I can ask you to recite a Surah Fatiha for the Isal Sawab of all the marhumin in our community, inshallah. Please recite a Surah Fatiha with after the loudest of your salawats, inshallah.
Thank you very much. Thank you very much, Dr. Maulana Zaidi, Dr. Mithani, for that very informative discussion. And I think it sounds like we're going to need another session after this, so inshallah we can do that. Thank you.